Good morning. It is Monday morning. It is time for Medication Mondays, the education before you take medication. Today, we are talking about emotional blunting. And I want to know, are Black career women and registered nurses using psych meds to cope with workplace issues and in turn causing emotional blunting that could absolutely destroy their careers, ability to create future income, their name, and even their family. So, there are some things I want to share with you just to help you make some informed decisions about work and health. My name is Glenna Davis. I am the founder, CEO at Glenna's Arts for Life, and this is Workforce Care. We are providing some solutions for Black career women and registered nurses to properly deal with the workplace, to overcome some sticky situations that's historically grounded here in our country, so that you can move forward, advanced, and ready for the best life that you have could ever imagine. And I'm not just saying that. So, as your workforce care nurse, I want you to know that before burnout, there is work fatigue. Work fatigue is chronic job stress that has begun affecting your mental, your emotions, your body, your ethics, and your spirit. And it often appears before disease fully manifests. This is why Black women and RNs may present to the doctor with these common signs and symptoms of mental issues, signs of depression and maybe anxiety, some fear, palpitations, things that can show that you're having some response to something like cortisol spikes, but because there's a lack of education in the workplace and a lack of understanding of what your role is as an employee, we, you know, and also we've been conditioned to understand what symptoms are and to see your doctor. That may not be the right position for you as a Black career woman and a registered nurse who's dealing with work fatigue issues in the workplace. See, and the doctor may end up getting you diagnosed with a disease that you have to carry for the rest of your life, medications that could injure you and take you out of your career and leave you disabled. So, we want to make sure that the correct path is set out before you so that you can avoid all of those situations that commonly happen with career women and burnout. When you go to the doctor with these signs and with these symptoms, and then you don't express that it is happening because of work, then you feel dismissed, confused, or unseen. What I do hear from a lot of Black women is that their doctors are telling them, these social media doctors and people who want to lure you in and get you on medications or whatever the case may be for their particular solution to help you get through your situation, is that they may say, don't tell your doctor about work. But if work is the cause of your symptoms, why wouldn't you talk about it? You should be talking about it. You should be talking about it. You should be talking about it, screaming it from a mountaintop, and not going in to private and confidential meetings with healthcare professionals who are supposed to be helping you. Instead, we would keep this private and confidential. There's nothing private and confidential about your employer doing illegal things that's causing you symptoms that you in turn get diagnosed and medicated for. We want you to feel seen. We don't want you to be confused. Confusion is not of God. Confusion is of the enemy. So already, if you're going to talk to some professional about what's going on at work and they're like, no, 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 let's just talk about the symptoms. Let me help you with your symptoms. That's confusion. So then you already need to make a judgment. You already need to say, maybe I'm not in the right place at the right time. You don't want to be dismissed. You don't want to miss your opportunity to do greatness and be called and be used to advance the situation in a healthy, equitable way. Most Black women and registered nurses walk away from the doctor's office saying that the doctor is ignoring me. They're gaslighting me. They're not. They're just not trained to help you. Doctors are trained to treat disease. They do disease management, medication, medical treatments. So they're listening. They're listening with a keen ear for your diagnosis, to diagnose you, to do differential diagnosis. They're listening so that they can hear what your symptoms are and help you silence your symptoms. But what if you're not supposed to silence your symptoms in a way that's going to reduce the stimuli, but then you use that spikes of stress hormones, the stimuli that's within you to handle the business at hand that you are hired to do so that you overcome the situation and never have to deal with that again. My people, particularly, have been dealing with racial and bias issues in the workplace, causing us to be mentally ill, physically ill, emotionally sick, spiritually diseased, because it's like, what God is going to let this happen? He's not letting it happen. You are letting it happen because you're being disobedient and not following the law of the Lord as Christ showed us to do when it comes to issues where the government policies are on your shoulders. It's a simple, simple thing that you need to do, and it's called faith at work and obedience. But in turn, what I did also, because I didn't know, I didn't have anybody to show me this path. And trust me, I was scared running. I ended up on a path from FMLA, from workplace discrimination, from workers' compensation, disability with a record, trying to access my ADA rights, got on a path that led me straight to psychiatry. If you have listened to any of my videos, and you already know, when you are dealing with mental health issues, psychiatric means soul, psych means soul. So you have to begin to consider your soul when you get on these paths inside inside the medical system, inside the healthcare system, and rights are involved and all of these things, and you have to consider your soul and you have to make some sound decisions. But I know that my people, Black career women and registered nurses, are not skilled in these areas, and that is why the workforce care is here. So about emotional blunting and how that impacts your career, your family, your ability to continue to create, and your courage. So, quick Google search, old trusty AI overview on Google. Thank you for not letting me have to do deep dive research, but emotional blunting, according to Google, is a psychological state where an individual experiences a severely reduced range of intensity of both positive and negative emotions. People experiencing it often describe feeling persistently flat, detached, and emotionally numb, unable to truly feel joy, sadness, or excitement. The core symptoms of emotional numbness, is a general inability to connect with your feelings, leading to experiences where happy and sad events no longer move you. Flat or blunted affect. Affect is how you do expressions on the face, reduces outward expression of emotion. This can include limiting facial expressions and unchanging tone of voice or lack of expressive gestures during conversations. Indifference, feeling of sense of detachment from yourself, your surroundings, or even the consequences of your actions. Common causes, emotional blunting is generally a symptom of an underlying condition, a trauma response, or a side effect of medication. Common causes include mental health conditions, frequently seen in major depressive disorder, schizophrenia, and post traumatic stress disorder. Medication side effects, commonly associated with the use of certain psychiatric medications, particularly SSRI and SNRI antidepressants, which I am big on educating career professionals about using these types of medications when you are working in high stakes occupations like registered nursing, medicine, law enforcement, pilots. If your issue is from workplace, you owe it to yourself to have a different option because for Black career women, getting started on SSRIs and SNRIs, especially if you are maybe a single mom, like have children, the range of emotions that you are going to experience and the change of behavior that you are going to experience can absolutely impact and affect your relationships at home with your children, with your community, and you want to be particularly careful with that. And then if you are a Black career woman who may be practicing as a registered nurse, you want to hear about the people saying that nurses don't care and look how she's looking and she's not responding, and well, she's medicated, she's trying to cope, she's trying to cope the best way she can with what's going on in the workplace. So this is why workforce care is important and the skills are absolutely necessary so that you don't transfer a blunting of emotional affect, flat affect, the negative and positive blunting of dealing with workplace issues. You want to be expressive. You want people to see on your face what it is that you are experiencing, especially if it has anything to do with microaggressions in the workplace, policies and biases that policies that are rooted in bigoted policies and bigoted thoughts about Black career women who are working that get transferred into policies that prevent you from growing. You want to make sure that you take care of the situation and not blunt and not medicate who you are. It goes on to say that emotional blunting versus other terms like apathy, while blunting refers to the lack of feeling and expression, apathy is specifically a lack of motivation, interest, or concern, not caring. And then they go on into management and next steps. I am not here to talk about management and next steps. I'm not even here to tell you not to take medication. If that is something that you feel is going to work for your situation, I do whatever you want to do. I know I was completely ecstatic that I was experiencing what I was experiencing at work. And I finally got to psychiatry and I was like, a pill is going to fix this? Give me the pill. Give me the pill. But baby, when I got so numb and I could have walked into a moving 18 wheeler and not felt a thing, and I was still practicing as a lung transplant coordinator, telling people how to advocate for themselves and how to protect their new set of lungs and their medication regimen, I felt like a fraud. So if you're okay with being a fraud, do what you want. I'm not here to change any of that. I am here to give you an opportunity to understand how to be encouraged and empowered about what you are experiencing in the workplace, especially if it lands in 5 areas: your physical health, your mental health, your emotional health, your ethical health, which is workplace responsibility, and then your spiritual health, the posture of your heart to be obedient to the God who has called you to do something in the workplace because you are experiencing discrimination or discernment. Same word, same word. There's where I want to help you. So, I'll be trying not to be on here too long, but okay, so let's see. So, my assessment shows that Black women are absolutely exhausted. They feel drained. They express the microaggressions. It is exhausting in the workplace. They also state that simply existing feels like labor. I was once there before, and combining those emotional feelings and then blunting them with an SNRI and an SSRI can absolutely lead to self harm, workplace violence, physical and emotional abuse in the home, the inability to control impulsive thoughts and behaviors, which is why we have to get to the root of what is going on in the workplace. We know what it is, but we also need to know, you need to understand how to address it, how to slay it, and how to advance past it. Can you imagine the amount of emotional injury it takes just to be Black and just to go into the workplace as a registered nurse and be dumped on? I really honestly, over the last 7 years, I have been comparing and contrasting RRNs, the new Black woman, the numbers and the physical diseases like Dr. Journey. Oh God, I'm not, am I gonna butcher her name? Post slave. Oh God. I'm gonna have to look it up because I wasn't even what is her name? Dr. Journey. Post slave syndrome. It's a book. It's a woman, doctor. I'm gonna put it in the comments, but she talked about the different repetitive stress injuries that Black people um, suffered from, and nurses are already known to have the highest rate of injury as any other occupation. And then there's other similarities, and it's just sometimes it's profound the way my mind works and moves and put things together to compare and to contrast and to give a warning to registered nurses that if you don't change the direction in what you're doing in the workplace, how you're responding to illegal activities that is maybe not be criminal in nature, but definitely leads to criminality in the people because we don't want our rights infringed upon. When our rights are not there, we feel and we become nothing more than a slave. That's where the term corporate slave come from. You don't want that. You have a right and a moral obligation to make sure that you are producing health, that you are preventing injury and disease for a chosen population and a community that you feel like you want to serve. And if you're in a hospital setting, it's every consumer, every healthcare consumer that is laying in your bed, every patient that is in your bed. The difference between a healthcare and a consumer and a patient can be nuanced, but your patients, you become their advocate. The healthcare consumer, you give them the power to advocate for themselves. That is our responsibility. Okay. So my workforce care diagnosis is Black career women know that their feelings and symptoms are from some workplace bias, from some bigoted leader, some policy that gets passed down from time to time, from generation to generation, and bias against this group so that it prevents growth. Black women's emotional fatigue is secondary to workplace violence, evidenced by the rate of FMLA mental health leaves. For your planning, when you take FMLA, you must plan. If you do not plan, then you plan to fail. You, you cannot continue just to take your FMLA and go on vacation, go on holiday, especially if you're actually having these type of issues in the workplace. It will behoove you to handle your business during them 12 weeks, to figure out through prayer, through biblical meditation, through fasting, through consulting with a with a workforce care professional, with attorneys, with somebody to collect information, to study cases online. That's what I did. I spent thousands of dollars, thousands of dollars consulting with doctors, meeting with workers' compensation attorneys, meeting with employment attorneys. Do you know I even discovered the nuance between getting a workers' comp attorney and an employment attorney? Workers' compensation, you're fighting to be disabled. Do you want to fight to be disabled? Or do you want to fight to work with an ADA accommodation? These are nuances that you need to understand and apply to the workplace, exercising your full rights. And none of it is going to feel good because you're going to want your rights to just be given to you, but your rights is a beautiful woman to be pursued. It's your responsibility to pursue them. No one's going to give you your rights. And if you don't use them, you lose them. Planning, take your 12 weeks off, but delay being diagnosed and medicated. Please delay being diagnosed and medicated. I sat with psychiatry for 2 years, and after taking the SNRI medication and having to detox off of that, which was completely hell, brain zaps, constipation, diaphoresis, could not form a thought. I was just, it was horrific. It was just horrific to have to experience that just so I can keep a job, a six-figure job, my home. These things I thought were at risk but of loss, but they're not at risk of loss. They want you to think that it's at risk of loss. It's only at risk of losses if you choose those things and deny obedience to God. I promise you, His word is true. But delay being medicated because at the end of 2 years, I was like, my doctor was like, Glenay, are you depressed? Dr. Silverman, what do you mean am I depressed? I've been here every week for 45 minutes and you have given me prescription after prescription after prescription. until I said, no, I don't want no more of your prescription. And you were like, try this at this time when I was trying to figure out if I wanted to continue taking it. And I can just hear God echoing in the back of in my mind after she was like, try it at this time and try it at that time. God was like, try me, taste and see how sweet I am. You gotta love the word of God. You gotta love the word of God. And she asked me that at the end of 2 years when she tried to medicate me and to help me and deal with the oppressive nature of work and how it was impacting my life. She tried to do electroconvulsive therapy on me to help me not remember the oppressive nature of work. Yeah, those are the things she tried to do. And then at the end of 2 years, had the audacity to ask me if I was depressed. No, doctor. I mean, sorry, if I was depressed. No, doctor. I was being oppressed. And had I not been in her company all of those years, she would not have saw the unfolding of what it is that I was experiencing. And then she she said when everything was all over and done, she leaned back in her chair and she was like, I'm Canadian. She's like, this is an American thing. Like she was blown away at the way my employers was treating was treating me. And they do this every day. But that's why I say delay the diagnoses. Talk to me. Take your work fatigue quiz. Ask for workforce care to be in your employer's house, your employer's place of business. You don't always have to go to therapy and EAP about workplace issues where they are not going to tell you how to overcome your situation. They're going to help you cope with the symptoms that you're expressing. You cannot change the system, you cannot change them. All you can do is let go and be obedient and go through what it is that your spirit is asking you to go through. If you're experiencing job stress lasting you longer than 6 weeks and you feel as if your your health is and you're tired in the mental, physical, emotional, ethical, and spiritual, take our work fatigue quiz. We want you to get the answers that you need. Okay? Until next time, be well.